the resource, and then we will touch on just a few resources that we think that you'll find helpful. So that's our plan for this session. So next slide. So let's talk a little bit about the nature of the opioid epidemic in Kentucky in particular. And if you'll go to the next slide, Carrie, we're going to focus on what it was that really pushed Kentucky to move beyond a focus on the individual with an addiction to more of a family and community systems approach. And so we know that individuals have experienced opioid addiction long before we recognized it as an epidemic. And in fact, some would say that the actual epidemic began in the late 1990s. In Kentucky, we certainly had pockets of work that was being done to address the opioid epidemic, but it wasn't until 2016 that our governor's office and several key state agencies, including my own Department of Behavioral Health, began partnering to create what we consider a more comprehensive, coordinated, cross-agency strategic framework to guide our opioid response efforts in the state. And it was at this time as well that we began to see more technical assistance and more fiscal resources being directed to states to address the opioid epidemic. Because overdose rates were staggering and continuing to climb, the focus of the technical assistance and funding was really on the individual with the opioid addiction. And the primary outcome at that time was really reducing rates of fatal and non-fatal overdose, because that was the immediate crisis that was at hand. Then we began to see what Suzanne Brundage of the United Hospital Fund refers to as the ripple effect of the opioid epidemic. We all know that substance use is a family disease. I personally am a family member of an individual in recovery from an opioid epidemic, so I can attest to that, that it is clearly a family disease. It's also a community disease because the impact does have a ripple effect into the community and into the systems that serve individuals. However, in the midst of the crisis, Kentucky, like I'm sure many of your states, maintained a primary focus on the individual with the opioid addiction and less so on those impacted through the ripple effect. But after a couple of years, we could no longer ignore that ripple effect. In Kentucky, we were seeing, and you see here on the bullets, some of the things that were really pointing to the need to focus on the family and systems. We were seeing increasingly high rates of parental and caregiver substance use, in particular with opioids, but some methamphetamine use on the rise, which certainly had a detrimental impact on children. We know that students who are exposed to family and community opioid abuse face acute and chronic stress and trauma. We began hearing from child care workers and educators and others that children impacted by the opioid epidemic were suffering from unmet basic needs like lack of sleep or lack of food, unstable housing, as well as the range of psychological difficulties. Not surprisingly, here in Kentucky, we also experienced increasingly high rates of substance exposed students. We experienced a 48-fold increase between 1999 and 2014, with nearly 2 out of every 100 women giving birth in Kentucky being diagnosed with an opioid use disorder. It was also at that time that Kentucky was experiencing our highest out-of-home care placement rates in history. We had over 10,000 of our around 1 million children in out-of-home care. And we also were seeing sharp increases in both kinship and fictive kin caregiving with grandparents, common kinship care providers. And I'm sure Kathy saw that in her own community as well. And so while we've made great strides in the state to shift our policies from a punitive to a treatment approach for individuals with opioid use disorder, Kentucky still ranks 3rd highest among states with children who have experienced parental incarceration. And certainly not all of those are drug-related offenses, but that separation is another form of trauma. According to the 2020 Kentucky Kids Count data, 12% or more than one in every 10 children in Kentucky has experienced the hardships that come along with having a parent in jail or prison. And these are shared sentences, really, and they negatively impact a child's behavioral, educational, and health outcomes. And so now Kathy's going to talk about some of the other levers here.
Excuse me, as we began to move forward in Boone County from the individual focus to the community focus, we found that our community didn't believe that there was an opioid issue. They said, not in Boone County. We found that they didn't believe anything happened in Boone County because they believe Boone County is Boone County. But what we found is that parents were not only sharing their opioids, and grandparents were sharing their opioids, as well as young people were just taking those opioids, that until it affected a family, there was not a belief in this community that it's important that we all work together. The social media impact on the lives of not only our teenagers, but our very young children caused some of our children to even be bringing their parents prescription drugs to schools and selling them on our buses. The community response to the opioid and other substance abuse, it's not a mental health issue, it's not trauma, it was more of leave us alone. This is the way our families work. So everything that Dr. Robbins said impacted us. Still, it's a crucial piece that we're all looking at the traumatic effects of the opioid usage in our families. I too experienced an issue with a family member that caused me to be traumatized at the same time as I was trying to take care of my husband. Next slide. We're going to move into community school collaboration to address opioid-related trauma. This is our tool that we're going to offer to you. It's in the handout, in the chat, if you'd like to take a look at it as we move forward. Next slide, please. So as you see here in this slide and in the document itself, REL created this handout to give us all a guidance as to how to create those collaborative processes. In the very first part on this slide, you will see a description of this tool, and it shows that what the purpose is, as well as the fact that there are over 170,000 children in our Appalachian region that are experiencing some types of stressors from opioid and other addictions and some kind of traumas, provided trauma that was associated with that. What has happened in many of our areas is collaboration was not something that occurred with us, and in many of your sectors in the community. We need to know that our staff and our students, we need to teach our students, our staff, how to work through the trauma, but we also need our collaborative partners. As we move forward on the next two pieces of this slide, you will see the resources that are available, how to and who are we going to collaborate with. It's very important that we utilize the community resources that we have, not only the mental health people, but our local doctors and nurses, as well as our private and public facilitators. We've used the YMCA, we've used the community-based coalitions. In Northern Kentucky, which is 3 communities, we have Boone County Alliance, Campbell County Alliance, and Kenton County Alliance. All of us work together as a team too. So if you take a look at that, you will see there are examples in that document that tells you several resources to contact if you need to contact others in your community. What we found is our faith-based resources, our faith-based community was extremely impactful to us. Next slide, please. This is the very top of that document, And what I need you to look at, if you would, is we are, as a community, we need to be working together for the same goals, the same objectives, the same processes. What we did in our community is we created a charter. We first went through a SWOT process and determined what our needs were as a community, and then worked together to leverage our resources in order to make things work successfully in our community. So collaboration was the key for us. Shared vision, shared mission, complementary resources. Without working together, we were not able to move forward. Tina? Next slide.
I think this is you, Kathy, still.
That's still me?
Yeah.
Okay. The other part, when we were building our charter and we were building our process, our goals and objectives, we looked at data. Data was that we all had access to, or we shared. We looked at the KIP data, the Kentucky, Tina, help me with this.
Kentucky Incentives for Prevention
program. We also have a terrace metrics programs, which was resiliency. And we looked at our school behavior data as well as compared data from our community organizations. We have a very specific referral process of which agencies to refer to and which agencies will meet the needs of the students. And again, as we talked about, our YMCAs and our social emotional learning processes in the schools were highly effective. Next slide. Shared purpose, mission, transparency, and trust. That was very hard as we started out with our SROs, our school resource officers, our judge executive, our mayor, and all of the governmental agencies here in the Boone County schools. We did end up setting out clear expectations, and we shared those services and resources together in order to make our process work successfully. Next slide.
So now, this particular, yeah, thanks. So this portion of the resource provides 4 steps, if you will, or stages, if you will, to building school community collaboration. And you'll notice it starts with the identification of possible partners, and then building your pitch, creating your network and engaging with the folks in your network, and then developing a collaboration plan. There's a couple of things I think that I would add here, and Kathy alluded to this earlier when she talked about their process, that even before step 1, you truly need to have a comprehensive needs assessment. And we're fortunate here in Kentucky to have some pretty significant data, surveillance data type resources that are accessible to schools. Kathy mentioned one of them, which is a student report survey that is called the Kentucky Incentives for Prevention Survey. It's actually carried out and paid for by my department under our substance use prevention work. But it's a voluntary survey for schools that gives school districts a wealth of information based on student report about substances, substance use. We've added mental health related things such as suicide and bullying and things like that over the course of the years. And so definitely look for surveillance data or any kind of survey data that you might have that will help you identify what the needs are in your community, and then also get input from your key stakeholders, as Kathy was talking about as well, because that will help you determine what the needs are and then which partners are going to be key to meeting those needs. A little bit later in the resource section, we have a resource that will help you around framing your pitch, if you will, how to frame your message. It's incredibly important to frame this messaging in a particular way, because as Kathy mentioned, there's a lot of stigma, there's a lot of denial on the part of communities that there's even an opioid epidemic raging in their in their own backyards. And so knowing how to frame that is critical. And we've got a really excellent resource in the resource list that will tune you into. I'd also mention, and again, Kathy alluded to this in their particular practice, but in addition to developing a collaboration plan, having a team charter, or sometimes those are called terms of reference, is critical. It helps everybody in the group, in the collaboration or in the coalition, to know what your shared mission and purpose and goals are, what your objectives are going to be, who your partners are, and basically how you're going to do business together. And so I definitely encourage, if you're not familiar with team charters or terms of reference, to check that out. And we can certainly share resources, templates that you can use. But I have found that type of document to be incredibly important, especially when you're working with a multidisciplinary team. Next slide, Carrie. This particular portion of the resource talks about the fact that collaboration takes time. And a lot of times I think it takes a while in communities to build up trust and to move through these stages of collaboration. But you can see here that it moves from no involvement, you do your thing and we'll do ours, all the way through to full collaboration where you do have a common purpose and objective in place. And so just be aware that your group, and educate your group as you come together, that you will be moving through different stages. Now, there are other frameworks or other stages of collaboration that have been touted in the literature, but I really like this one because it moves you from absolutely no involvement to full collaboration, and what your expectations need to be as you move through those different stages. Next slide. So as Kathy mentioned earlier, this resource has quite a number of suggested collaborative partners that you can consider. And again, I would suggest that you think about what your identified needs are from your needs assessment and consider which partners make the most sense. Now, certainly if you can get all these partners to the table, that would be amazing. They all have merit and they all bring things to the table. But one of the things that you may have to consider is your time and the resources that you can invest in engaging certain entities. And so you may need to start with those that are most pertinent to your needs or most relevant to the needs that you've identified. I just want to mention one thing. You'll notice here that mental health clinics and substance use disorder treatment facilities are listed as two separate entities. It depends on how your state is structured. In my case, and here in Kentucky, our Department of Behavioral Health encompasses both mental health and substance use, and we have facilities across the state, or community mental health centers across the state, for example, that offer both of those services. However, in some states, it may be structured a little bit differently, and you may have mental health providers and substance use providers that are in different facilities. So just be aware of that. And of course, youth serving organizations like YMCA and Boys and Girls Clubs are invaluable to helping being partners in this process. Next slide. The next slide has some additional partners to consider: healthcare centers, certainly primary care, because so many times primary care issues or healthcare issues are co-occurring with trauma and mental health issues. And so we certainly want to take an integrated approach to that. Obviously, there are lots of community-based coalitions that would be helpful partners in this process, and then clearly our first responders. Also in this resource are hyperlinks that will take you to some excellent examples of collaboration from other states. You'll see there a reference under first responders to West Virginia's Handle with Care program. I know that this group, and many of you are probably familiar with that, and that has been an incredible model for many, many other states, including Kentucky. And so I invite you to certainly check out the examples as a way to operationalize these various partnerships. And the next slide just shows some of the resources that are referenced in the resource guide. So I think on the next slide, we're going to pause for just a second and check in with our folks to see if there are any questions in the chat box or in the Q&A that we need to address.
Nothing in the Q&A right now, although I think some people are having some trouble accessing the document. So I'm going to put the direct link to the document in the chat. If that still doesn't work, we'll keep working on finding something that'll work for everyone.
All right, wonderful, thank you. Then I think we can move on to the next slide. So we're going to transition and talk a little bit about community school collaboration in action here in Kentucky, and how we have taken advantage of some of the elements of the resource that was produced by this group. And on the next slide, I'm going to talk at a very policy level, and then Kathy's going to get real with it and bring it down to the practice level. And so I want to talk through a couple of policy level examples of collaboration here in Kentucky. And in the first one that I want to talk about is our School Safety and Resiliency Act legislation. It was passed in 2019, largely in response to a school shooting at Marshall County High School in Western Kentucky. That shooting happened just a couple of months before the shooting in Florida. And so in many ways, the shooting that took place here in Kentucky was quite overshadowed, if you will, by the shooting in Florida. So some folks don't even realize that we actually had a school shooting here in Kentucky just prior to that. But it was, that shooting is really what spurred the development of what I personally feel like is one of the most comprehensive school safety pieces of legislation, certainly that we've had in Kentucky, but I would certainly elevate it nationally as well. It was a bipartisan act that comprehensively addresses both physical, what we call the hardware part of school safety, and the psychological or hardware safety of our students. And so it's a very well-balanced piece of legislation in that respect. And so there are some specific elements that came out of the school safety and are mandated by the School Safety and Resiliency Act that specifically address student trauma. So for example, districts are mandated to develop a plan for implementing a trauma-informed approach in their school districts. And those were due by July 1st, or had to be approved by the local boards by July 1st of 2021. So I'm sure Kathy was at the helm of that work in her particular district. But those district trauma-informed education plans are certainly driving the trauma-informed care efforts in the schools in our districts in Kentucky. Another piece of that act was the development of a trauma-informed toolkit to support school districts. And so our Kentucky Department of Education folks have been hard at work at developing that toolkit. They've been partnering with my Department of Behavioral Health for some expertise in that area. And we have jointly partnered to disseminate elements of that toolkit, and we're continuing to add to the toolkit in an ongoing basis. Another element, and there are lots and lots of components of this act, so I would encourage you to check it out. And we can certainly post the link to that act and some other resources around it. But another piece of that is particularly important with respect to trauma is Kentucky's notification system that we don't call Handle with Care here in Kentucky. It doesn't necessarily have a name, But it is modeled after the Handle with Care that I mentioned from West Virginia. And it's as it is in West Virginia, a notification system where if law enforcement is on the scene of a situation where a child is involved and there's potential trauma exposure, then there's a notification that goes to that child's school from the Kentucky State Police or whoever the law enforcement is on the scene. And the school gets the child's name, the age, their school, and then the notification to Handle with Care. And that alerts the school that that child may have experienced a traumatic event and may be experiencing some manifestations of that trauma exposure, and that the school should handle them in a different way than they may normally handle them. So that's been an incredible rollout here in Kentucky in partnership with our Kentucky State and other law enforcement agencies. So I want to talk a little bit about our Kentucky opioid response effort, and this is our strategic framework here in the state for how Kentucky is responding at the policy level and then trickle down obviously to the practice level to the opioid epidemic. And as I mentioned earlier, it started, our strategy initially was very, very much focused on just the individual. But as I said, when the ripple effects started happening, we began to recognize that we couldn't just focus on the individual with an addiction. We needed a more family and community-based response. And so we have added immensely to our strategy to encompass a broader perspective. And so just to give you a few examples of that, we partner very heavily with our Kentucky Department of Education to implement school-based prevention strategies. We have Sources of Strength, which is a suicide prevention, touted as a suicide prevention universal approach, but really does have at its roots the building of protective factors that support substance use prevention, as well as suicide prevention and other risky behaviors. We have Too Good for Drugs being supported through this effort, youth mental health first aid, positive action programming going on in some of our after-school programs like YMCA and Boys and Girls Clubs. We also have Plan of Safe Care work going on here in Kentucky, early childhood mental health consultants, specifically working with families with opioid use disorders. We have substance use residential programming for pregnant and parenting women that allow children to remain at the residence with their mothers and not be separated. We've worked on educating our judges and other court officials about opioid use disorder and at great length, because we know that there was quite a bit of stigma here in Kentucky amongst our judicial, within the judicial system. And we've also used some of our dollars that we've gotten from the feds, from the federal government, to expand several of our out-of-home prevention models, like the STAR in Kentucky, to support the child welfare system. And so I could go on. We have many, many initiatives that fall under this Kentucky opioid response effort. But my main point is that this is a multidisciplinary, collaborative strategy that we've taken, and it's multifaceted in the sense that it not only targeting the individuals with addiction, but also the families and the communities. So Kathy's going to pick up from there to take it to the practice level.
Wow, Dr. Robbins, that was outstanding. I don't know that I can even expand on that too much. You went through all of the pieces that Kentucky does. But what I wanted to talk about was that we started as the school system working on opioid prevention and other substance abuse and usage, because our circuit court judge came to us and he said, I need your help. We can't do this without the students and without the families working with us together. So we created a community drug-free Boone County Coalition. With that, we worked really hard on all of the charter, our goals. Still didn't do as much as we wanted to do. We weren't having an impact. So with that group, what we did is we started a mental health summit. We utilized some of the SAMHSA money that we received, and that mental health summit for 3 years was a 2 full days of trauma-informed social emotional learning, mental health, and substance abuse work, where all of our partners came together, and partners called us to see if they could come and be part of what we do. So we did that, and we're very successful until COVID came in and we couldn't do the summit the way we wanted to do last year. But that task force, that drug-free Boone County, has recently morphed to Hope for Boone County. We decided that it wasn't just focused on drug-free Boone County. It needed to encompass all of the other areas. Therefore, bringing in our Chamber of Commerce initiatives. We brought in 4 or 5 of our faith-based communities to sit and to develop programs within their churches. Our judge executive sits on that committee, on that task force. Our vice mayor sits on that task force. Every governmental agency in the community of Boone and some from the rest of Northern Kentucky sit on that task force. And we work as a team to make sure that in our schools we have employee assistance programs to ensure that we have not only clubs and organizations to help us, but new clubs inside the school district that will bring in private and public partnerships to help our schools. We have been able to write MOUs and contracts with both public and private healthcare services, and they are on site as well as doing telemedical mental health with our students. We've also been able to work with our parents to get them some mental health services. We've been able to work with our local Northern Kentucky community care, that is our North Key services, with our adults. We have brought several of our adults who are in rehab facilities in, and they've spoken to several of our 7th grade classrooms, talking about how it was for them, how it impacted their families, how indeed their children have sometimes disowned those people for being addicted to drugs. But we've also found that within all of the work that we're doing, many times our parents are encouraging all kinds of drug and alcohol and vaping use within their families. A big piece to what we've done in our high schools has been Drug-Free Clubs of America, that has been relatively successful. The problem with that organization was that the parents didn't want to pay for it. They said, my children are not going to do drugs. My children are not going to steal our medications. They're not going to do anything that is illegal, so we're not paying for it. So we've been able to get some of our community agencies to work with us. When we started working, we also had an issue with poverty here in Boone County. And there are several organizations like Master Provisions and some other programs that help our families to become more able to work with their children because everybody in the family has food. We've been able to do that kind of thing. Activating Hope is another organization within Northern Kentucky that works mostly with mental health and medical personnel. The 2 organizations get together and work together. Trying to think which other organizations and groups to talk about at this point. But it has been without the collaboration, without our groups working together, without our mental health summit, we would be back the same place we were in 2010 when we first started all of this work. Next slide. We're going to have time for questions if you'd like at this point.
And I did respond to the one question that was posted in chat about the passage of legislation for Handle with Care in Kentucky. So Rosalind, does that answer your question, or do I need to expand upon that anymore? Thank you.
Carrie, if there are no other questions, we're ready to move to our partnership discussions if you'd like.
All right, that sounds good. I don't see any other questions, so we'll move ahead.
Okay, this is what we're calling practical application. Carrie, you could go to the next slide. What we would like to do, we're going to be using a Jamboard, and Carrie's going to facilitate that for us. We have 3 questions. In each question, we're going to ask you to put up a Post-it note. Carrie's going to show us how to do that. The first question is, who are your current mental health partners? In addition to current partners, who else could schools, districts, and community leaders collaborate with? So we're going to want you to use a pink note that Carrie will show us and to answer those questions. So Carrie, they can write on those, they can get those pink notes. How?
Yes, so if you click the link in the chat to access that Jamboard, over here on the side, you can select the little sticky note icon, and then you can change the color up here. So if for now we're using pink, so select your pink color, and then you can type right here and click save, and then will appear on the Jamboard.
So take about 3 or 4 minutes and answer these first questions on a pink sticky or on a pink Post-it. Post those up there and we'll discuss later. Thank you all. We're getting lots of Post-its here. Hey, would anyone like to share what any of these partners or collaborators that are particularly helpful to you?
You can share in the chat, or if you raise your hand, I can allow you to unmute yourself as well.
Carrie, will we be able to get a copy of this?
Yes, and we have one person who is now unmuted, Jenny, to share.
Hi. So I put community service boards, nonprofits, and private counseling practices. So I'm actually a counselor who's doing research with educators. And I know when I was working in the community, we partnered a lot with school boards and local school counselors to help them with whatever they may need in the school system, and then just to advocate in a different way for families and students with issues around addiction or trauma or mental health needs.
Outstanding idea, thank you. Okay, can we go to the next slide, and we're going to do the next question, please. Okay, the question's here. What stage of collaboration are you in, and with each partnering agency, and what strategies can you implement to move to a higher level of collaboration? Why don't we use a green note this time? Take another 2 or 3 minutes and answer those questions.
And to get to this frame, you can just move these toggles up here and go to the 4th page, and that's where you can add your sticky note.
So folks, just as a reminder, the stages of collaboration that we mentioned in the resource, in case you don't have that in front of you, is no involvement, you'll do your thing and we'll do ours. Networking, let's talk, share information. Cooperation, I'll support your program and you will support mine. Coordination, let's plan an event together. And full collaboration, let's work together on a comprehensive plan to address the issue with a common purpose and objective. Thank you. Kathy, as folks are generating their responses, I have a quick question for you. Is it fair to say that you may be in a different stage of collaboration, let's say Boone County Schools, with different partners? Like you may be at a networking stage with one partner in your coalition, but you may be at full collaboration with another. Is that a fair assessment?
That's extremely fair. Yes, ma'am. Yeah. And each year we develop new partnerships. So we work through the stages.
Yeah, gotcha.
And you know, some of the agencies, some of our partners decide this is not what they're all about, and they back out too.
Yep. Yeah. We've actually had that experience at the state level as well, where it's outside, they feel like it's outside the scope of their mission. And one of the things that we often talk about in framing and you know, giving your pitch is it's not really just about what that partnering agency can do for you, but you also have to say what's in it for them, right? And that's part of the framing of your messaging around the collaboration. And in some cases, entities just decide that it's outside the scope of their mission, to do certain things. And so we've at the state level.
Sometimes it's a matter of sitting down and talking about what they have to leverage.
Mm-hmm. Yeah.
Sometimes they don't realize how important it is that whatever service they provide is expanded out, for example.
Yeah.
So would someone like to share in one of the stages of collaboration? And what can you do to move the next level?
Again, you can feel free to share in the chat, or if you want to raise your hand, I can unmute you.
Okay. No one wants to share today? All right, let's move on to the next question, if you don't mind, Carrie. So think about it, ladies and gentlemen. We're going to use the blue post at this time. What's your pitch? If you have an organization that you want to partner with, what's your pitch and how should it be framed? I can tell you our pitch was different for each different agency, just as Dr. Robbins and I were talking about, because for example, with the county, we talked about workforce development. We talked about the economy in Boone County. We talked about household trauma with many of our preschool partners. We talked about the poverty and the graduation rate. What's your pitch? You can select a partner and decide what the pitch might be, and how should you frame that if you use the blue Post-it this time. Are there any others that you'd like to pin up here? Would anyone be willing to talk about their pitch? Carrie, I don't see anything.
We have Rosalind, who I have just allowed to talk. Rosalind, do you want to share? We can't hear you yet, Rosalind, if you're speaking. So if you want to go ahead and share in the chat, feel free.
Carrie, I still can't hear, and I don't see anything in the chat. Can you?
No, I think Rosalind might have some technical difficulties with unmuting. So if there's anyone else who wants to share, please raise your hand or put in the chat. If not, we can move on.
If not, let's go ahead and move next slide. And ladies and gentlemen, we will share this information with you.
So as we wrap up, we certainly hope you'll take advantage of the particular resource that our collaborative developed around school community partnerships. But I also, on the next couple of slides, wanted to make sure that you're aware of some publications that might be helpful to you as you think about school community collaborations related to trauma. And in this case, this resource is more specifically related to the opioid epidemic. I mentioned Suzanne Brendage earlier of the United Hospital Fund, and Suzanne and a colleague, Carol Levine, worked together to host kind of a stakeholder expert panel sort of work group to really look at the impact of the opioid epidemic, and created this publication. And in this publication, which we took advantage of here in Kentucky and brought Suzanne in to keynote at one of our conferences, and then to have a follow-up conversation with us about how we could move out from just focusing on the individual with an addiction to, as you can see in this figure, the broader impact or the ripple effect, if you will, of the opioid epidemic. And so this is a great read. It's from 2019, but still very, very relevant, and also highlights a few programs and practices that are from across the nation that you may want to read up on and consider in your own efforts. The next slide is actually a follow-up that Suzanne did, which monetizes the projected societal cost of the opioid epidemic by state. And so we have used this particular information, particular to Kentucky, in framing some of our discussions around why we need to pay attention to the opioid epidemic. Now, a lot of that obviously has been overshadowed or shares a shadow, if you will, with COVID now. But certainly this information is incredibly helpful, and I would definitely consider using this in any of your arguments for additional funding or resources, fiscal or human. The next slide is a resource guide for 9 steps for building community partnerships with schools and around student mental health specifically. And so you'll notice it talks about leadership and needs assessments and having a point person, and just some really good tidbits for you to avail yourselves to when you get a chance. And then lastly, I wanted to make sure that you are familiar on the next slide with the Frameworks Institute. We have brought the Frameworks folks to Kentucky. But it's the application of social science methods to study how people understand social issues and how to frame your messaging. And there's a particular communications toolkit that Frameworks has developed around reframing family, school, and community engagement. And I can tell you that a lot of times how we intuitively think we should frame a message is not really what science tells us works most effectively. And we've learned that lesson the hard way here in Kentucky on some of our issues that we have. And so I really just wanted to make sure that you were aware of these resources and could take advantage of them, because we have in particular found them very helpful in our work, not just with trauma and the opioid epidemic, but in a much broader sense as well. So I think that's our last resource, and I think we are close to time. So Kathy, any last words of wisdom for the group?
If nothing else, don't ever give up. It's so critical to our United States, our Kentucky, Commonwealth of Kentucky, West Virginia, and Tennessee, and Virginia. It's critical to all of us in Appalachia that we continue to move forward and help to reduce the trauma that's going on in our communities. Thank you for joining us.
Thank you so much, Kathy and Tina, for that insightful presentation, for all of those wonderful resources. I know people, it sounds like in the chat, are looking very much forward to being able to dig in a little more to some of those. I wanted to quickly, before we close, just give you a little what's next. So if you want to go to the next slide. We have a quick 15-minute break right now, and then we will return to the full group for our keynote presentation by Michael Meat. Dr. Meat will provide us with the latest statistics on the opioid epidemic in Appalachia. Those findings are sort of a bellwether of the state of health of our entire nation. They'll give us even more inspiration to continue the important work we are all doing. So please join us back here at 2:45 p.m. Eastern. That's 11:45 a.m. for anyone on the West Coast. We've also put the link in the chat for the agenda. Next slide. As a quick reminder, we do encourage you to take part in our mindful meditation sessions. We've put the link in the chat as well to some of those. You can also find it on the resource tab of our summit website. And finally, on this next slide, if you need any help, you can always reach us at csoc.relap@sri.com. And I'll just note that is ccsoc.relap@sri.com. So thank you all so much for joining this session. And Kathy and Tina, thank you again so much for all of that wonderful information. And we look forward to seeing everyone at our next session.
Thank you.